there and take it easy.
Right now, we want to turn to developing news. Smoke from the wildfires burning out west is now nearing Europe. Data shows the fires are burning with an intensity far above average. And joining us now to talk more about the wildfires and the impact on Connecticut is Hartford Hospital pulmonologist Dr. Megan Panico. Dr. Panico, thank you so much for being with us.
Thank you for having me.
So this is really just such a tragic situation, and for people who are living close to these wildfires, it's been described as being in a crowded restaurant filled with people smoking cigarettes. What does wildfire smoke from these fires do to the lungs?
So unfortunately, the toxins from these wildfires are just like the toxins that we see with cigarette smoke. We know the nicotine is what's the addictive property with smoking, but the toxins are what lead to the lung damage. So patients and people can develop complications that lead to destruction of their lungs, such as emphysema or breakdown or tightening of their airways that leads to bronchospasm and makes it difficult for them to breathe in the short term, so they can be developing short-term problems of shortness of breath or long-term problems. We know that people that are exposed to these over time, such as firefighters or the people living in these areas, are at risk for being a new cohort of people that are at risk for developing COPD and prolonged lung damage. And if people already have lung damage, they could be triggered by this, and it's very important that they stay in contact with their physician and have their medications handy, and if they start to notice a change in their symptoms, have a plan for that.
Some good advice and information right there. It's truly amazing that this smoke has made its way to Europe. Yesterday we were talking about the fact it's obviously made its way to Connecticut. What impact does the smoke have on us here?
That's a great question. So fortunately, right now, we're not seeing a significant change in our air quality index in Connecticut. It is a little concerning to see the changes that we're seeing in the sunsets and the sunrise, but our air quality numbers have remained quite low. Albeit, we don't know what's going to happen in the future. And especially if you do have underlying lung disease, you should be watching these numbers. And if they are starting to rise, you may need to modify your activities, such as not being outside so much, and other things that can help you avoid breathing the air if the numbers start to go high.
And quickly, before we go, what's the best way to protect ourselves from the smoke from these wildfires? And are the masks that we're wearing to help us prevent COVID-19, can they assist with this?
So the best way to protect ourselves is to watch the air quality index. If we start to see the numbers go up, we should modify our activities. We shouldn't be outside as much. The masks that we're wearing, the surgical masks, the cloth masks, are helpful to help us prevent COVID-19 spread and protect others, but they're not the ideal masks if you're truly being exposed to smoke and to fires, and you really need something that filters particles, such as the N95 masks. But currently, what we have going on in Connecticut, we should be fine with our current cloth and surgical masks and continue our current practices here.
All right, good to know. Dr. Panico of Hartford Hospital, thank you so much for joining us. Thanks for your insight and for everything you and doctors across the state are doing right now.
Thank you.